I'm Jens Rueter. I'm the Chief Medical Officer at the Jackson Laboratory, also the Medical Director for the Maine Cancer Genomics Initiative, a program aimed at reducing disparities in access to genomic care, currently running in the state of Maine, and I am a practicing hematologist oncologist. One of the trends that has emerged is just the incredibly broad applicability of AI in healthcare in general. I feel like we're seeing um, aspects that I wouldn't have even considered beforehand. We're talking about home health care. We're talking about, system-wide adaptation of tools. We're talking about large data sets sort of feeding into models. So it's really has very many different angles, and I think that's actually it's a very enriching experience for sure. So we started with the Maine Cancer Genomics Initiative in 2016. It's all philanthropy funded and funded by the Jackson Laboratory as well. The goal of the initiative from the onset was to enable genomic care in rural Maine. And we developed a program of what we call genomic tumor boards to help clinicians better understand how to utilize the information as they're designing treatment plans for their patients. We've been doing this now for 8 years and have found that it is quite impactful for the clinicians. Even though it is time commitment for the clinicians, they do come to the meetings, present their patients, and always give a lot of very positive feedback that has really helped them understand the profile and to design the treatment plan. The success of the Maine Cancer Genomics Initiative has also led to a nationwide study that I'm leading through the SWA Cancer Research Network, which is the largest clinical trial network in oncology in the country. It's NCI funded, and we're running this study to see on a statistically relevant level what the impacts are of delivering genomic tumor boards to clinicians, what the impacts are on patient outcomes in terms of the number of patients that actually receive an evidence-based, genomically matched or informed treatment option. So that study has been running since for 2 years now, and we're going to complete enrollment early 2025, and we'll see from that study actually, how does this actually impact patient outcomes in the end. Yeah, I think oncologists are, and I think this is probably true for all physicians, actually inherently sort of conservative in how they take information in and how they use it in care, right? So I think just having sort of a black box at their disposal that kind of spits out an answer without really understanding why or what the reference is or what the information is based on, I think is not. I'm not surprised that this doesn't work as an approach. I think the way to bridge it is to be very thoughtful in how you actually utilize it, and sometimes it may not be in the direct clinician-facing way, but it may be in enabling the scaling of other decision support systems that may not be completely AI-driven or AI-run, but they support those, and then provide information back to the clinician with a clear rationale and with a good understanding of why this treatment would be the best treatment option for the patient. I think that's so the explainability of the information that is used in the decision making, I think, is going to be really important. And I would say that oncologists are constantly, oncology is a rapidly evolving field with new treatment options, new data becoming available sort of on a monthly basis. And at the same time, they're also faced with a lot of data that they're now collecting on their patients. And when they're getting this genomic testing or this NGS testing or biomarker testing, they're getting more information than they really know what to do with. So being able to have someone explain to them what might be the best option and why, I think is going to be the most impactful system. In addition, the current way that we're actually accessing information is also not scalable and has already become quite complicated. We're all held as clinicians to this standard of delivering evidence-based care, right? Guideline-driven evidence-based care. And if you're trying to access the current guidelines, it's actually already becoming very cumbersome. So in cancer care, they're called the National Comprehensive Cancer Network is a group of experts that gets together 4 times a year, and they basically refine sort of a treatment algorithm that based on specific features of a cancer. It's incredibly hard to access at this point because care has become so subspecialized, and so many biomarkers are now already part of routine care and are emerging, and they're trying to incorporate all this information in a very non-scalable fashion. It's basically a barely interactive PDF form that you access, right? So I think that there is an opportunity there for AI to also help, and kind of not necessarily pull information from anywhere on the World Wide Web, but to actually just deliver kind of an interface that will allow clinicians to access guideline information, for example. That would be another great applicability of care. And again, I think as long as clinicians are informed in a kind of concise manner as to why certain publications are being pulled or why certain recommendations are made, I think that's the most important part. It's actually very interesting to think about that patients fall into, I would say broadly speaking, probably 3 categories, right? There are the patients that are always want to be completely in control of their own care, and they do their own research, and they come back to the clinician with lots of questions and concerns based on their own research. Then there are the patients that are well informed, but they really just use that information so that they can feel more comfortable with the decisions that are being made by their physicians. And then the last group, though, is the patients that just come to the doctor and say, whatever you recommend, doc, right? And depending on where you practice, you'll have sort of different fractions of each one of these. I would say in my own practice, it's the most I think actually the most prevalent group is still the ones that trust the physicians in making these decisions. But I'm sure there are other centers or other areas where that is very different, and there's geography involved and patient populations and so forth. So I think also making any of these sort of decision support tools available to patients down the road is going to be really important, because otherwise they're already asking Dr. Google for information, right? And it's not, and nowadays might actually, even if you just go into Google, you might already have an AI supported system, which makes it even more complicated for a patient to understand what's actually real and what's not real. We've started actually, our program was initially purely designed as a physician-facing education program, experiential education program. We've recognized that patients also need to be better informed just about the basics, just starting with the basics of biomarkers, the basics of what is genetic testing, what is genomic testing. So we've developed educational modules for patients, and we have a patient advisory board as well that helps us sort of better communicate information to the patient population, to the general population. So it would be very interesting to think about, can we also design sort of again, down the road, sort of a search engine that will allow patients to have access to vetted information, but in a way that they can actually fully understand it. Well, so one thing I didn't talk about in my talk, but one thing that is very near and dear to my heart, it would be fantastic, and this has already been piloted, right? If you can actually take away the burden of documentation for physicians, right, with AI tools. I don't know why this should have already taken off, in my opinion, because I think it is one of the key barriers to this effective, soft communication with patients. If you have 20-minute or 30-minute slot for a complicated, cancer patient, where you need to talk about, very difficult decisions, sometimes end-of-life decisions, or even just choosing, amongst a series of not very pleasant treatment options. If you constantly have in the back of your mind that you still need to document all of this in a meaningful manner, it puts a lot of stress on your kind of presence in the exam room, right? If you had that burden taken away and you had some relief of that process, then you could, you could just actually really just sort of sit there with a patient and kind of talk it through, gives them the opportunity to really, think about what the information is, give them enough freedom to ask questions, to have family members ask questions. And I think those would be the things that I would imagine would really be vastly improved. So, I mean, I've now developed a system where because I don't have that many clinic days, so my clinic days are always quite packed. There's a long list of patients. And so what I do is I actually go into the room with a computer and I try sort of documenting as we're speaking, but I'm typing. Thankfully, I can type without having to look at my fingers all the time. So I try to make eye contact even while I'm typing, but there are some positives to this because you can actually reinforce a couple of things that you said, or you can ask the patient if you truly understood correctly. So the documentation might actually be better in the end, but I certainly wish that if there was some, voice recognition at that time point, that we could just assimilate all that information automatically. I think that would be really great, relief. I'm really looking forward to continuing the collaboration with the scientists here at Northeastern and at the RU, and I hope that we can really make an impact, in utilizing AI and machine learning in a thoughtful manner in complicated healthcare decisions in oncology.